So the request for information for the Participant Engagement Health Equity Workshop really came down to two common themes. The first was around community engagement strategies, and the second was around leveraging the research to address health disparities. Of note, this request for information received 69 responses, including 2 international responses. So in reference to community engagement strategies, these are some of the quotes directly from individuals who provided feedback into the request for information. So in reference to engagement, the respondents noted that meaningful involvement of community members from a very early stage in development of aims, procedures, analyses, and communication of results is important. In reference to communication, the major component of reassurance of the positive benefits of this will be constant communication, and that includes listening, education, and dialogue involving people who are respected and trusted by the community. Transparency is important. This project must operate with the highest level of transparency possible, including frequent project updates to key stakeholders. And in terms of partnerships, we should build not only national but local community action boards who will partner equitably with researchers. Now, around the common theme of utilizing the research to address health disparities, there were 4 thematic areas that rose to the top. The first was around multidisciplinary studies. Respondents felt that we should study the multiple determinants of health and their interactions, such as personal, social, economic, environmental factors, on disease risk, disease mechanism, and individual response to therapy. It will be critical to include careful, valid, and robust measures of social factors across the life course, including socioeconomic, psychosocial, and environmental conditions. We need to address what are the genetic and environmental factors across the lifespan that influence the development of disparities in risk and incidence or progression of hypertension, chronic kidney disease, and other chronic diseases. And finally, what new health literacy approaches will be necessary to ensure that patients and families understand precision medicine? And will these vary within subpopulations? So those are some of the salient highlights from the request for information. What followed subsequently was the workshop, and I'd like to share a few of those highlights with you as well. The first is around governance. Governance should include participants, and participant preferences should be given equal weight for decisions about research priorities, data sharing, and return of results. We should ensure that the cohort is designed to understand and address health disparities. And we need to define diversity holistically to include race, ethnicity, LGBTQI, all ages, people with disabilities, pre-existing conditions, comorbidities, socioeconomic status, education level, geography. A whole host of variables should be considered when defining diversity. In addition, there should be meaningful relationships, transparency, and trust. These are essential components in building a precision medicine initiative cohort. People are enthusiastic about the goals of the initiative, and many people may be more willing to share data than researchers or institutions might expect. Researchers should engage with participants and communities to convey the purpose of the research and how contributed data will be used so that participants can appreciate the value of the research. Federal and state agencies should continue to work together to ensure that policies that address data sharing and data access provide robust protection for participants while enabling data sharing.